Welcome back to Nursing School Week by Week. We've made it to the final part of our electrolyte series, and today we're tying it all together. We've already covered sodium and potassium, but now it's time to talk about two more heavy hitters, calcium and magnesium. Calcium isn't just about strong bones. It plays a huge role in muscle contractions, nerve transmission, and even blood clotting. And magnesium is the unsung hero of electrolyte balance, keeping everything running smoothly behind the scenes. When either one of these is off, your patient can go from fine to critical in no time. But we're not stopping at just the facts. Today we're putting it all into action with some case studies. Because let's be real, memorizing lab values is one thing, but knowing how to actually apply them in real-life situations, that's what makes the difference between a good nurse and a great nurse. So let's jump in and wrap up this electrolyte deep dive with everything you need to know about calcium, magnesium, and how to think through electrolyte imbalances like a pro. All right, most people hear calcium and immediately think of strong bones and teeth. And yes, that's a big part of its job, but calcium is also crucial for nerve function, muscle contraction, and even blood clotting. Without the right balance of calcium, your body wouldn't be able to send signals through your nerves, move your muscles properly, or stop bleeding when you get a cut. A normal calcium level falls between 8.5 and 10.5. And when those levels drop too low, our body lets us know in some pretty dramatic ways. When calcium levels dip below normal or below 8.5, the nervous system gets way too excited, leading to overactive nerves and muscles. There are two classic signs of hypocalcemia that every nursing student must know. The first is Chvostek sign. This is an easy one to check. Just tap the facial nerve right in front of the ear. If the facial muscles twitch in response, that's a positive Chvostek sign, meaning there's likely low calcium. The other sign you must know is Trousseau's sign. This one is even more telling. Inflate a blood pressure cuff on the patient's arm and leave it pumped up for about 3 minutes. If their hand starts to spasm and flex inward like a claw, that's a positive Trousseau sign. Another red flag for hypocalcemia. But it doesn't stop there. Severe hypocalcemia can cause tetany, which is a fancy way of saying uncontrollable muscle spasms. And here's where it gets really dangerous. If those spasms affect the muscles that help you breathe, like the diaphragm, it can quickly become life-threatening. Finding hypocalcemia early is important. Now let's talk about hypercalcemia, or too much calcium in the blood. We know calcium is great for bone health, but when there's too much of it floating around in the bloodstream, it has to go somewhere. And guess where it loves to settle? The kidneys. This is why kidney stones are a classic complication of hypercalcemia. These tiny rock-like deposits can form in the kidneys. And if you've ever heard someone describe the pain, you know it's brutal. Patients might experience severe back or side pain, nausea, or even blood in their urine as the stone tries to pass. But that's not all. High calcium levels also slow down the nervous system, making patients feel sluggish, weak, and just mentally foggy. Their reflexes might be delayed, and they could even experience muscle weakness. Instead of the overactive muscles we see in low calcium, hypercalcemia makes everything slow and sluggish. So if a patient is feeling out of it, weak, or complaining of flank pain, it's time to check those calcium levels. Next up is magnesium, an electrolyte that works behind the scenes to keep our muscles, nerves, and blood sugar in check. Magnesium is essential for keeping muscles and nerves running smoothly. It helps prevent overactive nerve signals, regulates muscle contractions, and even plays a role in maintaining a stable blood sugar level. Levels fall between 1.5 and 2.5, and when levels drop too low, things can get out of control. When there's not enough magnesium in the body, muscles lose their chill. They become jumpy, irritable, and prone to spasms. One of the biggest red flags for hypomagnesia is hyperreflexia, which means exaggerated reflexes. Here's how that looks in a patient. If you were to tap on a tendon, instead of getting a normal reflex, their muscles would jerk dramatically. It's like their nervous system is on overdrive. And if magnesium drops too low, things can get serious. Seizures can develop, making hypomagnesia a true medical emergency that needs to be corrected fast. So if a patient's muscles seem overly twitchy, their reflexes are too strong, or they start seizing, then low magnesium should be on your radar. Now let's flip the script and talk about hypermagnesemia, or too much magnesium in the blood. Remember how low magnesium makes muscles and nerves overreactive? Well, high magnesium does the exact opposite. It slows everything down. patients with hypermagnesemia might feel lethargic, like they just can't keep their eyes up. They might feel weak, like their muscles become sluggish and unresponsive, or have decreased reflexes. So, like you would tap on a tendon and instead of getting a normal response, you get barely anything. And if magnesium levels get really high, it can slow down breathing to dangerous levels, leading to respiratory depression. In extreme cases, the nervous system becomes so suppressed that it can even lead to cardiac arrest. So if a patient is too drowsy, has weak reflexes, or is struggling to breathe, then check those magnesium levels. They might have a little too much of a good thing. I want to take a moment to highlight some of the truly life-threatening electrolyte emergencies that you, as future nurses, need to be ready for. These aren't just numbers on a lab report. These are situations that can turn critical fast. All right, the first one is severe hyperkalemia. Remember, potassium is the heart's MVP, and when levels climb too high, the heart doesn't like it. Severe hyperkalemia can lead to cardiac arrest in the blink of an eye. I'll never forget one patient I saw in the ER, a middle-aged man who came in feeling weak and nauseous. His EKG showed tall, peaked T waves, a telltale sign of hyperkalemia. Before we could even finish his lab work, his heart rhythm started to slow. Then it flatlined. It was chaos. Nurses pushing calcium gluconate, insulin with dextrose, and preparing for a possible CPR. That's how fast severe hyperkalemia can turn deadly. All right, another life-threatening electrolyte emergency that you might see is severe hyponatremia. This is when the brain is in danger. Sodium is the boss of the brain, right? And when levels drop too low, the brain freaks out. It can lead to brain swelling, confusion, seizures, and even coma. My friend had a patient, a young woman who had been drinking way too much water after a marathon. She was talking one minute, then suddenly seizing the next. Her sodium had crashed dangerously low, and she had to correct it carefully and quickly to prevent permanent brain damage. All right, another electrolyte emergency you might see is severe hypermagnesemia. This is when the breathing can stop. Magnesium is the body's natural sedative, but too much of it, it's dangerous. Severe hypermagnesemia can slow breathing down so much that it just stops. A friend of mine once treated a patient with severe hypermagnesemia. The patient came in barely responsive, heart rate dropping, blood pressure tanking, and no one could figure out why. It turns out they had been taking way too many magnesium supplements at home, and their muscles were so relaxed. Even their diaphragm was struggling to work. All right, these are the electrolyte imbalances that can kill you. And as future nurses, you're going to be the first line of defense. You'll be the one spotting the warning signs, catching those subtle changes in vitals, and taking immediate action to save lives. Electrolytes aren't just something you memorize for exams. They are the tiny powerhouses keeping every single part of the body running. And when they're out of balance, it's up to you to bring them back to normal before it's too late. Okay, we've talked about what happens inside the body with electrolytes, but what about how we get those electrolytes in the first place? It all comes down to what we eat and drink. Electrolytes are basically minerals that carry an electrical charge when they're dissolved in fluids. So foods rich in these minerals are a primary source of electrolytes. Let's take sodium, for example. It's abundant in processed foods, salty snacks, and even some condiments. That's why watching your sodium intake is crucial, especially if you're at risk for conditions like high blood pressure. Potassium, on the other hand, is found in a bunch of fruits, vegetables, and even some dairy products. Bananas are a classic potassium powerhouse, but you can also get a good dose from leafy greens, potatoes, and yogurt. Calcium, the bone-building champ, is found in dairy products like milk and cheese, but also in leafy green veggies and fortified foods. And last but not least, magnesium, the muscle-relaxing one, can be found in foods like almonds, spinach, and black beans, and even dark chocolate. Yes, you've heard that right, dark chocolate. Now, here's where your nursing knowledge kicks in. Imagine this. You have a patient who's been dealing with persistent vomiting or diarrhea. They're not just losing fluids, they're also losing critical electrolytes that keep their body functioning properly. And that's where you, as the nurse, need to step in. So when a patient is losing fluids like this by vomiting or diarrhea, you have to think, which electrolytes are being depleted? Why are they being depleted? And what's the best way to restore balance? Depending on how severe it is, you might need to give IV fluids with electrolytes. So if the patient is severely dehydrated or can't keep anything down, they might need an IV solution like normal saline or lactated ringers to replenish sodium, potassium, and other key electrolytes. You might also need to encourage electrolyte-rich foods. Once their stomach settles, foods like bananas, avocados, yogurt, and broth-based soups can help restore potassium and sodium naturally. And then we'll often be giving electrolyte replacement like oral rehydration solutions or electrolyte tablets. And these can be a great way to restore balance if IV fluids aren't necessary. Your job as a nurse is to recognize the signs of electrolyte imbalances early and take action to fix them before things get worse. Whether it's replacing potassium after a bunch of vomiting or monitoring for sodium loss with prolonged diarrhea, understanding how electrolytes are lost and then how to replace them is a critical part of patient care. This is what makes nurses so vital. You're not just handing out fluids and food, you're thinking ahead, problem solving, and making sure the body has exactly what it needs to function. And that's a skill that will make you a life-saving nurse in the real world. I've gathered some game-changing tips from nursing students who have been in your shoes and stressed over electrolyte exams, tackled tricky NCLEX questions, and come out on top. So let's tap into their wisdom and see what strategies help them master this challenging topic. All right, one tip that they have is to don't just memorize. I know it's tempting to try and cram all those normal values, causes, and symptoms into your short-term memory. But the truth is, real mastery comes from understanding the why behind those numbers. You want to break it down. Why does hyponatremia cause confusion? Because osmosis pulls water into the brain cells, making them swell and malfunction, which leads to confusion, headaches, and even seizures. Why is hypercalcemia so dangerous for the heart? Because too much potassium disrupts the heart's electrical conduction, which can cause deadly arrhythmias like ventricular fibrillation. When you understand the mechanisms behind these imbalances, everything clicks into place. Instead of just memorizing symptoms, you'll be able to connect the dots and apply your knowledge to real-life clinical situations. And that's what makes a great nurse. All right, tip number 2 is to make connections. Electrolytes don't exist in a vacuum, in isolation. They're all interconnected, influencing each other and working together to maintain that delicate balance. Remember how aldosterone, the hormone involved in regulating blood pressure, also affects sodium and potassium levels? Or how vitamin D is crucial for calcium absorption? Start seeing these connections, these patterns, those cause and effect relationships, and it'll help you understand the bigger picture of electrolyte balance and how different imbalances can influence each other. And then tip number 3 is to practice, practice, practice. I know you've heard it a million times, but it's true. The more you practice applying your electrolyte knowledge, the more confident you'll become. Work through practice questions, case studies, even create your own flashcards for those normal ranges. Challenge yourself to think critically about different scenarios. What would you do if you encountered a patient with severe hyperkalemia? What assessments would you perform? What interventions would you anticipate? The more you practice, the more those critical thinking skills will become second nature, and you'll be ready to tackle any electrolyte challenge that comes your way. And perhaps the most important tip is don't be afraid to ask for help. Electrolytes can be tricky, and it's okay to feel overwhelmed at times. But reach out to your teachers, your classmates, your clinical instructor. Anyone can help you clarify concepts and answer questions just to boost your confidence. Remember, you're not alone in this journey. There's a whole community of nursing students and nurses who have been there, done that, and are more than willing to help you succeed. All right, there's one missing piece that we haven't really talked about yet, and that is patient education. We spend so much time in nursing school learning electrolytes inside and out, but what about our patients? They're the ones living with these imbalances, experiencing these symptoms, and making the daily choices like what to eat that affect their electrolyte levels. As nurses, it's not just about knowing the information ourselves. It's about teaching our patients in a way that helps them take control of their own health. So step 1 in teaching your patient about electrolytes is to speak their language. It's great that we can throw around terms like hyponatremia and hyperkalemia, and that will help you on the NCLEX. But for most patients, that's just confusing medical jargon. Instead, we need to break it down in simple, everyday terms. So when you're talking to the patient, instead of hyponatremia, use the term low sodium. Instead of hyperkalemia, say high potassium. Instead of hypocalcemia, say low calcium. Patients don't need to memorize lab values. They need to understand what's happening in their body and what they can do about it. All right, step 2 for when you're speaking to the patient is to tailor your education to each patient. Every patient learns differently, right? So a one-size-fits-all approach is not going to work. Some people do better with visual aids. So maybe show them a diagram that you found online or a chart. or even food lists can help them connect the dots. Others learn best through simple conversations or hands-on demonstrations. For example, let's say you're educating a heart failure patient about potassium. Instead of just telling them to avoid high potassium foods, you could show them a chart with high and low potassium food options. You could go over their typical meals that they usually have and help them come up with options to swap out that are high potassium foods. You could teach them to recognize symptoms of high or low potassium so they know when to call their doctor. The key is to meet them where they are and make it practical for their everyday life. At the end of the day, our job isn't just to treat patients, it's to teach them. The more we empower them with knowledge and confidence, the better they're going to be able to manage their own health, and the less likely we will be to see them again in the same hospital, in a month from now. And that's what being a great nurse is all about. All right, let's dive into specific electrolyte-related topics that we can educate our patients on. So if your patient has hyponatremia, how are you going to educate them? For patients with low sodium, hydration is important, but too much water can be dangerous. So here's what we can teach them. We want to teach them to stay hydrated, but be mindful of overdoing it, especially in hot weather or during intense exercise. Because excessive water intake can dilute sodium levels even further, making symptoms like confusion and weakness worse. And then if they have certain medical conditions like heart failure or kidney disease, those make it even more important to balance fluid intake. So an example would be if a marathon runner is chugging gallons of water without replacing sodium, they could be at risk for exercise-associated hyponatremia, which can lead to brain swelling and seizures. Patients need to understand that hydration isn't just about drinking more, it's about balance. All right, so what about hypernatremia? What if your patient is suffering from high sodium? Then the focus shifts to drinking enough fluids. Encourage them to drink plenty of water, especially those older adults who might not even feel thirsty. Limit high sodium foods like processed snacks, canned soups, fast food, and pay attention to thirst cues. Feeling excessively thirsty can be an early warning sign that sodium levels are climbing. A lot of elderly patients in nursing homes aren't drinking enough fluids, and they can easily become confused, weak, very thirsty. Those are all classic signs of hypernatremia. All right, what about hypocalcemia? For patients with low potassium, diet and medication awareness are key. We want to encourage potassium-rich foods like bananas, potatoes, leafy greens, yogurt, and warn them about taking certain medications. Like if they're on a diuretic, those can flush out potassium. And then teach them to recognize symptoms. So if they start feeling fatigued, cramping, or have any irregular heartbeats, they should let their doctor know. So for example, a patient on furosemide, that's the diuretic, for heart failure might not realize that it's draining their potassium levels. And without proper replacement, they could end up with severe muscle cramps or even heart issues. All right, and then hyperkalemia for patients with high potassium. Small dietary and medication changes can prevent serious complications. So we want to limit high potassium foods like oranges, potatoes, spinach, avocado, and emphasize compliance to their medications, potassium-lowering medications like Electrolyte or diuretics to help the kidneys excrete excess potassium. We also want to explain why hyperkalemia is dangerous, because they may not know. Too much potassium can stop the heart. If they notice muscle weakness, tingling, or irregular heartbeat, they need to seek immediate medical attention. So an example of a patient who might have hyperkalemia is a dialysis patient who skips treatments or eats a high potassium meal like a banana smoothie with spinach and avocado. They could push their potassium levels too high, leading to life-threatening heart arrhythmias. So at the end of the day, electrolytes play a huge role in our health. And as nurses, our job is to make sure our patients understand how to keep their levels balanced. A little education can go a long way in preventing serious complications. All right, you guys, it's time to put your electrolyte knowledge to the test. Let's work through a real-life scenario and think critically about how we would assess and care for this patient. All right, you are caring for a 78-year-old woman admitted with pneumonia. She's been on IV antibiotics, but has also been having frequent vomiting and diarrhea. Her latest lab results show a potassium level of 3.1. So what electrolyte imbalance are we dealing with here? That's right, hypokalemia or low potassium. Remember, normal range for potassium is 3.5 to 5.0. So 3.1 would be low. Now let's think about why her potassium is dropping. In this case, she's got a few things working against her. First of all, GI losses. Every episode of vomiting and diarrhea flushes out not just fluids, but also essential electrolytes like potassium. And then she's been taking antibiotics, right? So antibiotics can interfere with potassium absorption, making it even harder for her body to maintain normal levels. All right, now let's put on our nursing caps and think about what assessments we need to perform. We need to do a cardiac assessment. Potassium is crucial for heart function, so we need to check heart rate and rhythm, blood pressure, and look at an EKG to look for hypocalcemia signs like flat T waves or even dangerous arrhythmias. And then we also want to check the muscle strength because low potassium can cause muscle weakness. So we check grip strength. Can she squeeze your hands firmly? Leg strength. Can she lift her legs against gravity? And respiratory effort. The diaphragm is a muscle too, and severe hypocalcemia can make breathing difficult. And then we also want to check on her hydration status. Since she's been losing fluids, we assess skin turgor. Does her skin bounce back and stay tinted when pinched? Check her membranes. Are they dry? And her urine output, is she peeing less than normal? Is she peeing at least 30 mils an hour? And now that we know what's going on, let's talk about what we're going to do about it. The first priority is to correct her potassium levels. So we're going to need to do potassium replacement. But huge nursing red flag. We never give potassium IV push, right? Instead, potassium is diluted and given slowly through an IV bag to prevent dangerous heart complications. All right, future nurses, now you've got the full picture of electrolytes: sodium, potassium, calcium, and magnesium. You've seen how imbalances can turn into life-threatening emergencies, and now you know exactly what to do. But if you haven't watched parts 1 and 2 yet, stop what you're doing and go watch them now. Click here to start from the beginning, and I'll see you there.